Welcome everybody to our webinar. We're recording from Assuta Hospital, the southern coast in Israel. We are in a very unusual and uncertain times, and we're here to provide as much information and reassurance and encouragement as possible. They say information is power, and we're here to give you as much information and help you feel as powerful as possible in these times. We are lucky today to be joined by the Director General of Assuta Hospital, Dr. Erez Barenboim, the head of our infectious disease services, Dr. Daniel Gruppel, and Mayan Hoffman, Jerusalem Post senior correspondent. Opening remarks from Dr. Barenboim, please.
Hello, guys. As I said before, my name is Erez Barenboim. I currently act as the CEO of Assuta General Hospital. I'm a MD, physician by profession, also specialist in internal medicine. I've had some various managing positions and commanding positions before I came to this office, basically the Air Force and the Medical Corps of the Army. And afterwards, I've been to a few hospitals in managing positions. But I must tell you that the current corona epidemics is by far the most challenging experience for me as a manager, the CEO. I'll start by mentioning a bit about Assuta General Hospital. Assuta is a general public hospital. And we have more than 300 beds, and we are the newest hospital, general hospital built in Israel in the past nearly 30 years. And even though we have just 300 beds, we are very good equipped, and we have most of the imaging capabilities and other technologies that you need for a modern hospital. The only two wards that we miss here are neurosurgery and cardiac surgery. Aside from that, we're really in full capacity and all capable of treating patients. We have a modern emergency room, and we see between 60,000 to 65,000 patients each year in our emergency room. So we started preparing for the corona about a month and a half ago. I mean, it was at the beginning with just a story of an epidemic running in China, but it took us a while to understand it's going to be an emerging global epidemic, and we started getting prepared. The first thing that we did is to allocate one of our wards to become afterwards our corona ward. The way to choose a ward to become a corona ward is to look for a ward that you can separate in any mean from the other wards, especially in ventilation when it comes to air conditioning and air tunnels that are separated from other wards. And we looked for a place that could contain nearly 30 patients for the first part of the corona preparedness. So aside from choosing a place, we had to choose people that will be joining this ward, and we started that about a month and a half ago. And most people came to work in that ward that was to be in the future volunteering for that mission. We mainly took people from the internal medicine wards, but some of them from the emergency room and some of them from the intensive care units. So we were basically preparing our staff for ventilated patients and other patients. And we started training from time to time and some simulations, but until 2 weeks ago, when we started gathering infected patients in Israel, it was just a plan. 2 weeks ago, we started building this ward. We had to evacuate orthopedics to another location, and we added a lot of technologies in this ward that will help us separate between the treating personnel and the infected patients. As a manager, one of my worries is to prevent infection with one of my staff. So the main idea was to minimize as possible the interaction between the infected patients and our staff. So we have TV that watches the patient, cameras that watch the patients. They can speak to us without direct contact. We can monitor all the essential signs all the time without touching the patients. And the idea was that most of the day, nobody would go into the ward unless needed because of the physical state. So we really built a new ward. We filled it with stuff. And we opened the ward 10 days ago. The capabilities for now are for 27 patients, and we can we can ventilate 4 patients, and as I said, 27. Currently, we have 11 patients. 2 of them started on ventilation yesterday because the condition deteriorated in the past few days, and one of them is an healthy guy, about 50. The other one has some prior disease, chronic disease, making him prone for serious infection. But the other one is a really healthy guy that got infected. Now, I will let the other talk about the medical issues, but I want to talk about managing. First, my concern, as I said before, is to protect my staff. And you should know that people are very stressed. They're not in panic, but they're very stressed. One of my aims is to prevent panics. So I put a lot of my daytime, my schedule on talking to people, going around the wards and talking to the staff and reassuring them. One of my main issue is reassurance. We have enough protective staff, we have enough technologies, you have enough time, you have enough time to train and simulate, and if you need more simulation, we do some more simulation. So that's one part. And the other one is getting a protective gear for the personnel. We anticipated less than we need. Currently, we are very busy gathering more equipment and protective equipment for our staff to prevent infection. And it's becoming a challenge as a manager to provide all the needed protective stuff for the personnel. Currently, we feel quite good, but if we look forward to the next 2 weeks, we believe that we will have like 20, 30 patients on ventilation, and that's what we are planning for. And we intend to open another ward in the next 2 weeks to hospitalize like 70 more people with corona, because we believe that the high peak of the corona is going to come between 2 weeks to a month, and this is what we are preparing for. And as I said before, it's quite a challenge, but I feel, and my people feel that we can manage it. And that's cool. Move it to you. So thank you.
Thank you, Dr. Barazan. That was very reassuring to hear that. Mayan Hoffman joins us. And I just want to note that if you have questions, we will have a question and answer period at the end of the discussion. So feel free to write them in, and we'll meet the questions later. Thank you.
Wonderful. Well, thank you. We're really excited to be here. I'm Mayan Hoffman, the news editor at the Jerusalem Post. And Tanya, why don't you tell us a little bit about yourself?
My name is Daniel. I'm an infectious disease physician by training. I've done my training here in Israel. I went to medical school in Israel in Beersheba and trained there as an internal physician and infectious disease physician. Sorry, I have to speak up. I live in the Negev in a kibbutz called Shramim. It's about 90 kilometers from here, and I commute every day. My wife is also she's also a doctor. She's a pediatrician. We have 2 little girls at home, and we're in a challenging place right now, both professionally and family-wise and personally. So it's a busy time.
I can only imagine, and as we heard even before, it seems that coronavirus is not something that people could have expected. Nobody could exactly plan for it. It wasn't something that we knew was coming, and there are a lot of open questions still about the virus, how it performs, whether we're going to build a community to it going forward, will there be vaccines or treatments, and how are we even going to hold up? How long is this all going to last in Israel and around the world? I wanted to start with some basic questions that I think people, Google online and try to figure out some of the basic things that they need to know about coronavirus. So first of all, why don't you just talk to coronavirus versus the disease COVID-19 that seems to be being used interchangeably often in media?
So coronavirus or coronaviruses are a family of viruses that cause disease in humans that we know about. We see those diseases every winter. The four most common viruses cause the common cold, basically. So we see them every winter. We usually don't make a definite diagnosis of what virus exactly is because it's very mild disease.
There's a request for you guys to speak much louder. It's hard to hear you. Okay, thanks.
Okay. So basically, the coronaviruses that we know cause the common cold. There were a few exceptions to that rule. One was in 2002, 2003, a new coronavirus emerged in China, in Guangdong area. It caused a disease called SARS, severe acute respiratory syndrome. That disease caused a very acute, very severe respiratory illness with a high mortality rate of around 10%. And that disease faded away and it died out due to very efficient public health interventions by the Chinese. Another severe coronavirus emerged in 2012, 2013 called Middle Eastern Respiratory Syndrome. It's also a zoonotic virus. It's a virus that came from animals to humans, and it caused a very severe disease, again, a high mortality rate of around 30%, but not very infectious, and we're seeing some re-emergence of that virus coming and going since it emerged for the first time. And early this year, close to the end of last year, this new virus emerged. Now, this virus is called, it's been called nCoV-19, but then it was renamed, which was novel coronavirus 19, but it was renamed to SARS-CoV-2. Okay, that's the official WHO name. And the disease that it causes is called COVID-19, or coronavirus disease 19. So it's the name of the virus and the name of the disease.
Great, and it seems to be that there is still some confusion regarding the symptoms of the coronavirus. We all know that a fever, coughing, respiratory challenges are the highlights or the standard symptoms, but there can be other symptoms as well, and it can be confusing for people to figure out which is sort of causing some of the panic. Can you talk a little bit about the symptoms of this coronavirus?
So the symptoms that you described, cough, respiratory distress, fever, are the most common symptoms that we see. And those are the most common symptoms described by the Chinese CDC, which described currently the largest number of full cases. There is a very wide variety of symptoms that can occur, but those are the most common symptoms. Among them also are myalgias or muscle aches, body aches, and some reports of loss of smell and loss of taste, which is interesting. Now, it's important to note that those symptoms are very non-specific, and there is no definitive way to diagnose coronavirus just by symptoms alone, or just by a clinical diagnosis. And to make the diagnosis, we need laboratory confirmation. Currently, the most common laboratory method that we use is called the PCR, or polymerase chain reaction, which is a laboratory test that tries to find the RNA or the genetic material of the virus itself. We usually swab from the nasopharyngeal space behind the nose and the oropharyngeal space behind the mouth, and look for the virus in respiratory secretions there. There are other tests that are in development. This test is the best test that we have today. This is the test that we
Great, and I understand that we're increasing the number of tests here in Israel. That we were doing around 750 a day. We went up to over 2,000 a day. Yesterday we had over 3,000 tests. The goal is to hit somewhere around 5,000 tests per day by next week, and then up to even 10,000 a day, which will help us to better understand how many people in Israel really have the virus. But that is actually a question worldwide because there's a discrepancy between how many tests each country should do, how contagious the virus really is. And there's one methodology in the United States, one in the United Kingdom that's very different, and then us sort of sitting there in the middle. Tell me a little bit about that. How infectious is this virus, and how many tests do we, or why test, and how many tests should we be doing?
So those are very challenging questions. First of all, about how contagious the virus is. It's pretty contagious. We have a number, a magic number called R0 or R0, which is basically, or easily put, the number of people that can be infected by a single ill individual. So if we're talking about diseases like the common cold or the seasonal flu, the seasonal flu has an R0 of around 1.3, 1.5, which means that if I'm sick with the seasonal flu, I can infect on average 1.5 other people. Okay. Now there are very, very infectious diseases like measles, where the R0 is around 18, which means that one person can infect 18 other non-immune individuals. COVID-19 sits closer to the seasonal flu with an R0 of around 2.3 to 2.5, which means that every infected person can infect, on average, between 2.3 and 2.5 other non-immune individuals. So it's more infectious than the seasonal flu, less infectious than other very infectious diseases that we know. So that's one. But our goal is to reduce that number of infected individuals per single ill patient through either vaccine, which we don't yet have, or public health interventions like social distancing. Because if I don't see any other person while I'm sick, I won't infect anyone. So the R0 will be 0 and the disease will start to decline. So the public health interventions split into a few different pathways. One is, like I said, the social distancing, which we'll talk about, I guess, in a few minutes. Testing is a very, very important very important public health intervention, because if you know that someone is sick, you know to isolate them better or to quarantine them in certain areas at a distance from other people. That testing should also be, we should test the people that need testing, because if we just go around and test the entire population, that will give us a false sense of security, because these tests are not perfect and we don't always get an accurate result. B, will deplete our resources without getting a very significant change in the course of the disease. And C, it's very, very difficult. We'll not only spend a lot of money, but also a lot of other resources like personnel and testing. So we need to better select the people that we test. We're starting to drift away, or we're drifted away from strict epidemiological criteria. At the beginning of the epidemic in Israel, we only tested people that came from abroad or had contact with a known case, but we're getting more and more liberal with testing, because we understand that there is a measure of, there is a level of community transmission of this virus. We know that it's here. We know that it's getting transmitted in the population. So we're testing more and more people without previous epidemiological connection.
People without previous epidemiological connections, but who have symptoms?
Yeah. Treating or testing asymptomatic people is very, very, it's a very challenging place to go to. We don't currently have good evidence that testing asymptomatic people is useful. We do know that a certain percentage of people with the disease will not develop symptoms or will not develop significant symptoms and develop very mild symptoms, but we don't yet have the evidence or the knowledge enough to decide on widespread screening. This is not the best test for screening because it doesn't have the characteristics needed for screening. So we're not there yet.
Now, what about the Ministry of Health's recommendations? It seems that every other day you're rolling out a new set of recommendations or restrictions, guidelines, now orders for the country. There's a meeting today that Netanyahu had held, and he said that likely sometime this evening he's going to roll out yet another level of guidelines for the community, actually targeting older people who are more at risk for the disease or for the virus, potentially shutting down additional stores and other places. So tell me what we're doing here and how the health ministry's restrictions are helping Israel to stop the spread of the virus.
Okay, so we're going to the place. We're getting to the heart of the matter, to social distancing. Now, the best way to stop an epidemic of a disease that is transmitted from person to person, when we don't have a good vaccine, is to prevent people from seeing each other. And to do that, we need to create social distancing, which means that we need people to see each other as little as possible. So in order to achieve that, we try to, or the Ministry of Health tries to shut down places where a lot of people get together and meet. So, of course, that entertainment and pubs and restaurants are the first places that you need to address, because those are non-vital places that you can shut down easily without a severe social impact. But I think that to get better, the gradual steps are not because we're not seeing enough effects and we need to do more, because these steps takes time to see the effect, and we didn't wait enough to see whether they're effective or not. I think it's mainly because it's easier to shut down things gradually than to shut them down all at once. I think that the social acceptance of steps like that will be better if they're gradual and not we don't have a pitfall of shutdown of everything at once. So I don't know yet whether these steps are effective enough. We don't know yet because we'll start seeing the effect soon, not yet. But our goal here is to flatten the curve, which means that we don't want a very high, narrow peak of infections. We don't want everybody getting infected at the same time, because then our health system won't have the capacity to deal with all those sick people. We want to flatten the curve. We want to maybe maintain the same number of people infected, but to have it happen over a longer period of time, so that our health system will have the resources and the manpower to deal with all those.
Right, and not every hospital is a Assuta hospital. There has been maybe hopefully more of the resources and a strong team was able to set up. It seems that the country has been able to put together the hospitals, made different units, put together teams to be able to work in rotation, to be able to handle the number of sick patients. Today it was over, I think 1,200, if I remember correctly, about 1,200 sick patients in Israel. But the health system in general was struggling before the coronavirus rolled out. We have a deficit of beds, a deficit of nurses. So are our restrictions here in Israel specifically stronger in order to help us to allay what was already a weak medical system?
Short answer, yes. I think it has we need to look at it from two directions. First of all, of course, we have to be a lot more careful than other places with better safety margins with their health system. We're running every winter at about 100% capacity in our internal medicine wards, and we're very short-staffed. And we have a very low number compared to the other OECD states of ICU beds per 10,000 people. So we need to be very careful on that end. But I think that it's also a matter of policy. I think that the Ministry of Health policy from the first from the get-go was very very strict, but sensible. I mean, I think that a lot of people said that we're panicking or that we're overreacting when when Israel first was one of the first countries in the world to shut down air travel and to restrict travel very efficiently. But I think that the entire world did the same steps 2 weeks later. So I think that we're seeing a good effect from those responses. I think that's part of the reason that we have such a low case fatality rate compared to other places, because a lot of the people that are currently infected are people that came from abroad, which are generally the younger people, more healthy people, and not the people that had the community transmission. I think we'll even out with the rest of the world eventually, but we have that delay because of the very efficient first few steps that emerged.
Great. So it seems like Israel's steps really are achieving the goal that the Prime Minister and Health Ministry set out to achieve. And it's interesting also to look abroad at China, for example, whereas for the last couple of days they had no new cases. So we know that there is a possibility of actually beating this virus, or we hope. So talk a little bit about that and what we can learn from what we're seeing there in Asia.
China and South Korea both did amazing work with controlling this virus. Each country took a slightly different approach. South Korea did an amazing epidemiological surveying job. They did a very careful contact tracing of every patient, with careful isolation of every suspected case, with hundreds of thousands of tests, which was a very effective strategy. China took the more forceful quarantine strategy without a lot of tests, but just a lot of quarantine. So if you were suspected or suspected contact, you were just quarantined, which is also very effective. However, we're not China and we're not South Korea, and I don't think our population will be receptive to those kinds of strategies. So we need to tailor the public health interventions to the society that you're doing it in. Take the UK, for example, which took a completely different strategy, but I think they're backing up from those decisions. I think that public health has a very cultural basis to it, and I think that we're doing the best that we can do, considering how our society is built and how our culture is. We have very large families, which is unlike Eastern Asia and unlike Northern Europe. It's challenging situation, but I think that currently we're doing a pretty good job at handling it.
Great. So let's bring it back directly to the hospital here, to Assuta Ashdod, which I know is a model for how many of the hospitals are setting up their teams, working to ensure that there'll be enough staff, enough materials, protective equipment for the staff. So tell us a little bit about what you've had to do in terms of shifting the way that staff works to ensure success.
The last few weeks were very intensive in shifting the entire hospital from day-to-day operations to pandemic preparation. It was a tremendous effort by all the teams. We basically rewrote the book on how you run a hospital in 2 weeks. And part of those changes were new strategies of how you bring in patients to the ER. We separate the respiratory patients from the rest of the patients in order to protect our staff. We know that the medical personnel is in a very vulnerable place. We see a lot of patients, we see a lot of sick people, and we want to give the medical personnel dealing with respiratory patients the best protective equipment that we can give. So we separated those patients from the rest of the patients, and we created a pathway for them inside the hospital. Changing the shift, how shifts are built, was also another very big change for the hospital. We want to create teams inside the hospital that don't meet with each other, so that if someone gets infected, we don't bring down an entire ward. So we shifted from shift work of regular 8 to 4, 4 to 11, 11 to 7 shifts to 20 to 12-hour shifts. You go to work for 12 hours and then you go home for 24 hours and come back for another 12 hours, which is very challenging for the staff. But that way we have set teams of doctors and nurses and all the other staff that takes care of patients, and they don't meet. It's very challenging to transition between shifts without meeting in person, but we're doing that, and we're trying to stress the point that there should be as little contact as possible between teams to avoid cross-transmission.
So I'm assuming that you've set up 3 teams working in 12-hour shifts, and that way, if God forbid, one of the teams would have an infection, you would have a 24-hour set to avoid. Amazing. Now, you yourself mentioned that your wife is a doctor, you have 2 children. How are you balancing? You're an essential worker. You were allowed to go out to work. So how are you balancing? Not only allowed to, you are required to go out to work. So how are you and your wife balancing this during this time?
This is challenging, like I said, very challenging time for a family. The immediate solution was the grandparents, right? Our parents. We don't really want to have our kids go in and out of our grandparents' house, of our parents' house, to not harm them. So the first few days until we started doing some searching for babysitters, that was the solution. But now we have a babysitter coming in every day. We say goodbye to the kid in the morning. We see them sometime some point in the evening. But it's hard. I mean, there are solutions in the hospital, but Assuta is very far from my house. I won't drive my girls here, and it's a challenge. And I know that this is going to have an effect on my family, but I feel that we're in a place that we can't be picky. And there are some sacrifices that we'll make. This is another, but it's a very challenging time for me.
Are you ever scared? I mean, you're doing an essential service, which is helping patients with coronavirus, which, as we talked about, is extremely contagious. Do you worry for you and your family?
I think that whenever I see patients with coronavirus or with respiratory infections, I use the protective equipment that we give out in the hospital, and I feel very safe when I'm doing it. I know that there is a good chance that my family will get infected at some point, maybe in the community, and we will see someone in a different place, not in the hospital. I know that it's a possibility that it's going to happen. I don't think it's going to happen to me here in the hospital. I hope not, because we take care of our staff, give the best protective equipment we can give, and we try to have very clear procedures on how to see those patients.
Great. Well, I know we're going to want to move to audience questions, so I just want to ask you one more question. We have a lot of people, from what I understand, that are tuning in from abroad, and they might have kids here, grandkids studying in Israel, who are concerned, about whether they should jump on the next plane and head home, or are they best to stay here? Can you offer some advice to those viewers?
Well, of course, that everyone should do what they feel is best for them, and I don't want to tell anybody what to do in those situations. Again, family is very important to everyone, and everybody wants to do the best for their families. I think that Israel is a pretty safe place to be in right now. I feel that our coronavirus situation is pretty much under control. We are seeing an exponential growth in cases, but that's to be expected. And I think we're doing a pretty good job with our public health interventions. Of course, if anybody wants to go home, we won't stop them. But I think this is a pretty safe place to be in right now.
Okay, we ready for some audience questions? Okay,
Yeah.
The first one is from Donna in Miami. there is no vaccine against AIDS or Ebola. What are the chances of finding a vaccine for COVID-19?
I think chances are good. I think chances are pretty good. There are already vaccines in the pipeline that seems promising. Developing a vaccine is a very lengthy process. It takes a lot of regulatory effort and a lot of we need very big trials in order to do it. I think that we're going to have a vaccine in the next 12 or 18 months. I'm optimistic. I think we will.
Okay. Nicole from Tel Aviv and Daniel from Philadelphia have both asked, do masks and gloves in public or crowded places, if there are any crowded places left these days, really protect, or is that not enough?
Okay, so I'll separate those things. Gloves, I think that gloves are not a very good thing. I think that gloves reduce the number of times you wash your hands. And I think washing your hands is more important than putting on gloves. Either washing your hands with soap and water or with alcohol gel if you don't have soap and water available. But I think that the best thing in order to maintain hand hygiene is to wash your hands. About masks. Masks in general are not needed when you go around the street or do your daily business. Masks are especially useful if you feel ill and you have to go out of the house, because the best thing is to stay in the house. If you have to go out of the house, then put a mask on yourself in order to protect others from your secretions, from your cough, from your sneezing. So that's the main role of masks. I think that we should leave the masks for healthcare settings and not use them in public. I don't walk on the street with a mask. I think that only if you have a running nose or a cough, then you should use a mask in public. It's in line with WHO recommendations. We recommend it pretty much.
Fantastic, that was very helpful. And here's a question from Nicholas in Milan. Is it true that there's a vaccine against pneumonia? I heard that Merkel had one the other day.
There is a vaccine against a bacteria that causes pneumonia. It's called Streptococcus pneumoniae. It's a very efficient vaccine to prevent basic infection with that bacteria, but it's irrelevant to this disease, which is a viral disease. We don't have a vaccine yet. It's called a vaccine against pneumonia because it's easier to sell it that way, or to don't mean sell it. I mean, it's easier to explain to someone that you're getting a vaccine against pneumonia, but it's not a vaccine against pneumonia in general. It's a vaccine against one bacteria that's causes pneumonia.
Okay, and we have this question: how much, on average, what is the average time period from the manifestation of symptoms until the time the virus is out of your system?
Very, very good question. Very hard to answer. In the mild cases, it takes a few days for the virus to clear out. We know that it's between 7 days and 14 days that you can get your virus can be cleared. But in the more severe cases, it takes a lot longer, and we get cases that run on for weeks at a time, and those are the more severe cases. As a rule of thumb, if you feel bad, if you have a cough or a cold, but you're okay, but you just feel a little bit ill, you should stay at home, avoid contact with others, and not leave your home until you feel better. And it's been at least 2 days since you last felt ill. And again, it doesn't matter if it's coronavirus, RSV, or influenza. That's the best way to prevent spreading any respiratory infections to the other people.
Okay. One of our viewers in Israel writes, there's a lot of talk about herd immunity. When can we expect it in Israel?
Herd immunity is a term that we use mainly when we have either an effective vaccine or when a disease infers permanent immunity. We don't know yet whether this virus will cause permanent immunity after you've had it once, or maybe the immunity will wane after a few months. We don't really know that yet. But in order to have a herd immunity, you need to have a lot of people immunized. If we talk about a disease that has the R naught of COVID-19, it's, I think, well about 80%. So I don't think we'll see herd immunity anytime soon, unless we get a vaccine.
Okay, great. Well, I'm going to just join you on this side and thank both of you. Thank both of you for joining us today, especially I know you're both extremely busy and you've taken time away from patients and your kids and life to join us, so we all very much appreciate it. We're going to send out an email with a link to this interview and discussion so that you have that and you can share it with your friends. We're planning a few more coming up, so stay tuned. We're here to keep you informed and we're here to keep you healthy and safe. So thanks very much and have a great day.
Thank you.
Thanks. I shake your hand, but
Yeah.
okay. Take care.